ਸੋ ਸਵਾਗਤ ਹੈ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਮੈਡੀਕਲ ਸੈਗਮੈਂਟ ਵਿੱਚ। ਐਲਨ ਗਲੈਸਰ ਜਿਹੜੇ ਕਿ ਇੱਕ ਨਾਮਵਰ ਫਾਰਮਾਸਿਸਟ ਹਨ ਤੇ UBC ਵਿੱਚ ਕਲੀਨਿਕਲ ਇੰਸਟ੍ਰਕਟਰ ਨੇ, ਇਹ ਸਾਨੂੰ ਅੱਜ ਦੱਸਣਗੇ ਕਿ ਸਾਡੀ ਬਾਡੀ ਵਿੱਚ ਪੇਨ ਕਿਉਂ ਹੁੰਦੀ ਹੈ ਤੇ ਕਿਹੜੇ ਤਰੀਕਿਆਂ ਨਾਲ ਅਸੀਂ ਆਪਣੀ ਪੇਨ ਨੂੰ ਘਟਾ ਸਕਦੇ ਹਾਂ ਜਾਂ ਖਤਮ ਕਰ ਸਕਦੇ ਹਾਂ। ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲੈਸਰ ਦਾ। Welcome to the program.
Thank you, Harpreet.
Thank you. So today we would like to talk about pain. Why does our body feel pain, and what are the prescriptions which we can use by which we can reduce or finish off the pain?
Well, you and I feel pain because there's damaged tissue.
Right.
If you can imagine, if you've ever, banged your finger, your wrist, or twisted it, what happens? Some cells get damaged. They burst open.
Right.
They release some histamine, okay? So they release the chemical that tells the body, oh, we've hurt ourselves. Instantly what happens is swelling starts to happen.
Right.
Now, if you've ever injured your wrist, it can swell up, gets bigger, but your hand's still, pink. The blood's flowing through there, so what got blocked? Well, the body's sewer system plugged up and caused the backup. That's what the swelling is.
Right.
Okay, so the drainage didn't happen. And instantly then, once the swelling happens, it tells the pain sensors, pain, pain, pain. Your brain gets the message.
Right.
Swelling hits the pain nerves, and you stop using that joint. And it hurts. So you're not going to run around and use that wrist anymore because of the pain.
Right.
So what drugs do now, now that you understand what happens, we have damaged tissue. The body has to clean up that tissue. Once it's removed, then the swelling, then the healing can happen. We got to increase blood flow, but meanwhile, you don't move the joint, for example, because it's all swollen. You can't move it very well.
Right.
So we have decided there's a number of ways that we stop it. Number one, if you don't want to take a pill, conventionally we used a rub.
Right.
The newest ones are called Voltaren. This is the extra strength, or you can use the old school A535. That's the stuff that stinks,
Okay.
like wintergreen.
Right.
Has that smell. But it's doing something called being an anti-inflammatory. So when you have swelling and pain, it's called inflammation.
Right.
These drugs interrupt the body's response to pain or to the damaged tissue.
Right.
Stop the inflammation, so it stops the swelling. The swelling can go down, therefore the pain message goes down, and you feel less pain.
Okay.
It does act on our brains too, but it also acts where the injury is.
Right.
So to reduce swelling and to control your pain. Okay, two things. Basically, either you use, so that's two things. In other rubs,
Right.
they use things like menthol.
Okay.
They use things like capsaicin. So what they're, menthol and capsaicin are kind of counter irritants. They can irritate that part of the body. They don't act as direct anti-inflammatories, but they cause this irritation that gets your mind off the pain.
Right.
Okay, so those are other products. Then we have our typical pain relief. Now, these three, which is the Advil, the Aleve, and the Entrophen,
Yeah.
they're based called NSAIDs. People may have heard this word NSAIDs, non-steroidal anti-inflammatories.
Right.
And what that means is they actively reduce the swelling that happens, the inflammation, when you've injured yourself.
Right.
So if we reduce the swelling, number one, and we reduce the pain, number two, which because it acts centrally.
Right.
The other one that doesn't touch the swelling part, but will control the pain because it acts on our nervous system to dull the pain sensors, is acetaminophen or Tylenol.
Okay.
So if you have a problem where you see a swelling, and you can take, what happens with these three different drugs,
Right.
it can upset the stomach. Okay, that's the biggest drawback
Right.
of these three. The first three I told you, the Tylenol will control pain,
Right.
but it will not upset the stomach.
Right.
Okay, like these other three. The only problem with Tylenol is that there is a maximum dose.
Okay.
Two tablets of the extra strength. You can take that up to 8 pills a day for anyone under 65. If
Right.
you're over 65, the recommendation is 3,000 milligrams a day, which is 6 pills.
Right.
Because when you go over the amount, and I've heard many people tell me, oh, 2 doesn't work, I got to take 3 or 4.
Right.
You're actually destroying your liver.
Oh.
Okay, the problem with this,
Right.
you know, it is safe when taken as directed.
Right. But if you overconsume it, it can harm you also.
That's right. This one, the acetaminophen, or
Right.
Tylenol, can destroy some liver cells. And over the long term, if you continue to take it at too high a dose, yes, you get liver disease.
Right. So now, Alan, these medicines, what you're talking, have they been taken continuously? And along with that, what about water? You know, in one of the programs, we talk about cough and cold also, and like pain when it is. Does consuming of more water help you?
Yes. So here's the other thing we know about pain. So if you're in pain, whether you've got heartburn pain or you got lower back pain,
Right.
one of the interesting studies, and there's a doctor wrote a book about his particular clinical research on water, was that he'd take a patient, he'd tell him increase the amount of water, and the back pain would start to disappear. So what's happening? If you're dehydrated,
Right.
remember in the back they got cushions between the vertebra. So that cushion is full of fluid.
Ah.
If you're dehydrated, meaning not taking enough water, the body's going to get water from somewhere.
Right.
Sometimes it takes it from your stomach, and then you get heartburn. Because sometimes it takes it from that, you know, shock-absorbing cushion, which is full of fluid, and it takes a little bit from it, and then all of a sudden you get pain. And when you drink enough water, you actually, help resolve that pain.
Right.
So I've had a number of clients who come in for consultation at Mark's Pharmacy at 80th and 120th Street in North Delta. We come in, we talk about their pain. The simplest thing to do first is increase the amount of water you take.
Wonderful.
You know, at least 4 to 6 glasses of water a day.
Right.
And see if that can help before I can, we'll start with everything else. Now, the problem with these things on an everyday use, whether you take Entrophin, whether you take Aleve, whether you take the Advil, if you take it every day, 1 per 100 people in a year end up in hospital with a bad stomach bleed. It literally causes a hole to be eaten in your stomach, and you may bleed.
Right, but that is only if you overconsume it, not as directed by the physician.
That's right.
Right.
If you take it, because people they don't have to be, normally a doctor is involved here.
Right.
But people decide to take Advil, Aleve, Entrophin, or aspirin every day of their lives, and 1 per 100 will end up in hospital with a bad stomach bleed.
Thank you very much for this information. Thank you.
You're welcome.
ਸੋ ਅੱਜ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ, ਐਲਨ ਗਲੈਸਰ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਹੈ ਕਿ ਪੇਨ ਦੇ ਕੀ ਕਾਰਨ ਹੁੰਦੇ ਨੇ। ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਸਰੀਰ ਦੇ ਵਿੱਚ ਜਦੋਂ ਸਵੈਲਿੰਗ ਹੋ ਜਾਂਦੀ ਹੈ ਤਾਂ ਸਵੈਲਿੰਗ ਨਾਲ ਜੋ ਹੈ ਤੁਹਾਡੇ ਪ੍ਰੋਬਲਮ ਕ੍ਰੀਏਟ ਹੁੰਦੀ ਹੈ। ਉਸ ਵਾਸਤੇ ਆਮ ਤੌਰ ਦੇ ਉੱਤੇ ਅਸੀਂ ਮਲ ਲੈਂਦੇ ਹਾਂ ਕੋਈ ਦਵਾਈ ਨੂੰ, ਜੈਲ ਲਾ ਲੈਂਦੇ ਹਾਂ, ਜਾਂ ਫਿਰ ਅਸੀਂ ਕੁਝ ਖਾ ਲੈਂਦੇ ਹੈਗੇ ਆ। ਤਾਂ ਉਹਦੇ 'ਚ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਦਵਾਈ ਖਾਧੀ ਜਾ ਸਕਦੀ ਹੈਗੀ ਹੈ, ਇਹ ਪ੍ਰਿਸਕ੍ਰਿਪਸ਼ਨ ਡਰੱਗਸ। ਲੇਕਿਨ ਇਹਦੇ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਇੱਕ ਚੀਜ਼ ਉੱਤੇ ਫੋਕਸ ਕੀਤਾ ਹੈਗਾ ਹੈ ਕਿ ਵੱਧ ਤੋਂ ਵੱਧ ਪਾਣੀ ਜ਼ਰੂਰ ਪੀਓ। ਕਫ ਹੈਗਾ ਹੈ, ਜ਼ੁਕਾਮ ਲੱਗਾ ਹੈ, ਜਾਂ ਤੁਸੀਂ ਖਾਂਸੀ ਕਰ ਰਹੇ ਹੋ, ਜਾਂ ਤੁਹਾਡੇ ਕੋਈ ਦਰਦ ਹੋ ਰਹੀ ਹੈ ਕਿਸੇ ਵੀ ਸਰੀਰ ਦੇ ਅੰਗ ਵਿੱਚ, ਤਾਂ ਜ਼ਿਆਦਾ ਪਾਣੀ ਜੋ ਹੈ ਇੱਕ ਤਰ੍ਹਾਂ ਦਾ ਉਹ ਲੂਬਰੀਕੈਂਟ ਵਜੋਂ ਕੰਮ ਕਰਦਾ ਹੈ, ਤਾਂ ਉਸ ਨਾਲ ਤੁਹਾਡੀ ਬਾਡੀ ਨੂੰ ਬੈਨੀਫਿਟ ਮਿਲਦਾ ਹੈ। ਅਤੇ ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਆਫ ਦ ਡਰੱਗ ਕਾਊਂਟਰ ਤੋਂ ਡਰੱਗ ਜਿਹੜੇ ਤੁਸੀਂ ਲੈ ਲੈਂਦੇ ਹੋ, ਇਹਨਾਂ ਨੂੰ ਜਿੰਨਾ ਦੱਸਿਆ ਗਿਆ ਉਨਾ ਹੀ ਖਾਓ, ਵੱਧ ਨਾ ਖਾਓ, ਇਹ ਸਮਝ ਕੇ ਕਿ ਇਸ ਨਾਲ ਤੁਹਾਨੂੰ ਜਲਦੀ ਰਾਹਤ ਮਿਲ ਜਾਏਗੀ, ਉਸ ਦਾ ਨੁਕਸਾਨ ਵੀ ਹੋ ਸਕਦਾ ਹੈ।